Feeding, eating, and elimination disorders. So in this section of the DSM, we're going to talk about a couple of different disorders. These include disorders related to eating disorders, and issues related to food. So the first disorder in this section that we'll talk about is pica. So pica is the persistent eating of non-nutritive food or non-food substances. So on TLC, there's this show called My Strange Addiction, and you all know how I feel about TLC, but it has a number of episodes about individuals who eat sand, who eat clay, who eat non-food substances. These are all issues of pica. So you're eating things that are not food related for at least a month consistently. And it's not appropriate based on the developmental level of the individual. So this is not the case of kids who are ingesting sand in a sandbox because it's part of their play. This is individuals who are doing this intentionally beyond what's expected at their developmental level. And again, this is not part of their cultural or social practice. So there is some instances of eating non-food objects related to cultural expression, spirituality or religious expression, or things that are socially normative. This would not be the case. So this has to happen in and of itself. And specifically, it's severe enough to warrant clinical concern. This might be part of something that goes along with another mental health disorder, for example, anxiety or panic. The next is rumination disorder. This is repeated regurgitation of food, which means that it's being brought up and re-chewed, re-swallowed, or brought up and spit out. And this is not necessarily, there's a trend of chewing food and then spitting it out for the sake of weight loss. That's not what we're talking about here. So this is not focused on weight loss. This is not purging. So this is not vomiting for a purpose of weight loss, like in something like bulimia or purging related to eating disorders. This is involuntary. So it can be, we also want to rule out things like autism disorder or intellectual disabilities. We want to make sure this could go along with something like those where we have texture or sensory related issues. And so sometimes those are co-occurring. So repeated regurgitation is not better explained by some sort of medical underlying issue either. So it's not acid reflux, it's not gastroparesis, it's not some other type of gastrointestinal issue. It is specifically to do with not being able to keep the food down. And again, this is independent of any kind of eating disorder. And if it's happening within some type of neurodevelopment disorder, it's sufficiently severe to warrant additional diagnosis. So it's not better explained within the context of the symptoms of another disorder. If you're thinking of putting the rumination disorder diagnostic label on a client, it needs to be severe enough to warrant that second diagnosis. So moving into avoidant and restrictive food intake disorder. This is feeding or eating disturbance with persistent failure to reach appropriate nutritional needs. This is the idea of being a picky eater. And it's more about the food than it is about weight loss. So anorexia, bulimia, and eating disorders of that type are really more about body image and weight loss. This is more about the food, potentially the texture, the taste of the food. And we're looking for a marked weight loss or not being able to achieve expected weight gain in terms of children in their developmental process, looking for nutritional deficiency to the point of potentially needing things like feeding tubes, oral supplements to be able to get enough nutrients to function. And so this clearly gets to the point of interfering with psychosocial functioning in general. This is not about not having enough food to eat. So food insecure families is not what we're talking about here. So there's food available, the individual is just not consuming that food. And it's not a culturally sanctioned practice. So thinking about things like Ramadan or thinking about religious and spiritual practices that involve fasting, that's not what we're talking about here either. So this one is in particularly important to think about cultural context because there are a lot of instances where individuals don't partake of certain foods because maybe they're keeping kosher or they're Orthodox, or they forego food altogether for periods of fasting. And then this is not just related to an eating disorder such as anorexia, bulimia, and there's no evidence that this is related to body image or weight. And we have that same caveat in all of these related disorders about if it's in the context of another disorder, it has to be so severe that it warrants another diagnosis. So let's talk about anorexia, and just warning, trigger warning, these eating disorders might be especially difficult to delve into. So be aware of what's needed to take care of yourselves as we talk about these things. So anorexia nervosa or anorexia is the restrictive food intake relative to what you need to function. And so you need a significantly low body weight in context to what's developmentally expected for your age, sex, developmental trajectory, and physical health. And so that's one of the important things with anorexia is we have to have that low body weight and below what's considered normal for children, adolescents, and adults. With that comes an intense fear to the point of causing anxiety about gaining weight, being overweight, and anything that interferes with weight gain. So even though you're at a significantly low weight, you're going out of your way to make sure that you don't gain weight. And so disturbance, this happens related to the way that your body weighs, the way that it's shaped, and the fact that you have very low body weight just really doesn't register or really isn't a concern. So we have two specifiers. We have restrictive type, which indicates in the last 3 months the individual has not engaged in recurrent episodes of binge eating. Weight loss is accomplished primarily through dieting, fasting, and excessive exercise. And then we have binge eating and purging type. During the last 3 months, the individual is engaged in recurrent episodes of binge eating and or purging. So you can have anorexia with purging. Really the key indicator here has to do with percentage of body weight and weight loss. So talking about eating disorders, anorexia and bulimia that we'll talk about here in a moment, the treatment for these is very tricky. There's often an underlying trauma history that triggers these kinds of things. A lot of times these might be specific to body image, but also this might be a form of control for individuals. I can't control the things going on around me, but I can control what I eat and what my body looks like. And so we see a lot of these communities online that are called pro-anorexia or pro-ana subreddits or websites. And these are essentially support groups for people who want to continue their eating disorders. And it's important as clinicians that you're aware of these things because they are sources for your clients to seek out further inspiration or further support in their anorexia as opposed to their recovery-oriented environments that you might find online. So I pulled these from a website called Thin Intentions. There's also subreddits specific to pro-anorexia or pro-ana. And just listening to some of these, describing what it's like to navigate this disorder. So I'm going to read through these for you. So the first, ana, meaning anorexia, must be the center of your life, and that's true. It ends up coming before everything else. This one says, eat in front of a mirror, naked or in your underwear if possible. If you can't, carry a picture of yourself in a revealing outfit and look at it when you want to eat. When you have cravings, pinch your fat, look at your problem areas, and don't add to them. So there really is this thought of needing to restrict things to an extreme amount. And there's a lot of self-criticism in that too, right? As you read through this, it's there's something wrong with you and you have to fix it. The next one is wear a rubber band around your wrist and snap it when you want to eat because food equals pain. Do not eat anything unless you know the exact amount of calories in it, because that's a big thing is restrictive calorie counting. Friends will only get in the way. Avoid them until you reach your goals. So it's very isolating. Friends don't understand this. And that's a bit of a tricky thing because the goal keeps changing. There's always this challenge of can you be smaller? Can you be thinner? And you never really get there. If you live alone, put thinspo or reverse thinspo, meaning pictures of larger bodies, on the pantry and refrigerator. A mirror works well too. So you're literally looking at yourself when you're going to seek nutrients from a fridge or a pantry as a deterrent for eating. Write your current weight on one hand and your goal weight on the other, and when you go to eat, you'll be reminded how fat you are and how skinny you could be. Moving into bulimia, this is recurrent episodes of binge eating. And an episode of binge eating is characterized by eating in a short period of time an amount of food larger than what that individual would typically eat in the same period of time under normal circumstances, and a lack of control over that eating. So this is the individual who opens a pack of cookies and eats the entire thing because they can't stop. That's not the same as like eating an entire pack of Oreos because Oreos are objectively delicious. I can relate to this. This is like, I want to stop and I just can't. And there's a couple of example clips for you in the module that show some examples of binging. It really is an emotionally painful, self-deprecating situation for these individuals. So followed by that is recurrent inappropriate compensation behaviors in order to prevent weight gain from the binge eating. So this might look like vomiting, this might look like laxatives, this might look like diuretics, other types of medications. And it's interesting reading about the use of some of these diabetic medications for weight loss. That really is an enabler of things like bulimia, because you can binge eat and then take your Ozempic or your Wegovy and you can get rid of it. Also, this looks like fasting, so eating a whole lot and then eating nothing, or excessive exercise as a result of binge eating. So these need to be happening on average at least once a week for 3 months, which is pretty all-consuming. Self-evaluation is unduly influenced by body shape and weight. And that means it doesn't matter what weight you are, you always feel like you're not good enough. And these things happen no matter what. Not all individuals with bulimia are going to be underweight. Some of them might be at very typical weights. And so you can't always judge who has eating disorders, particularly bulimia, based on what their body shape is. And this can't be just in the course of anorexia. There has to be binge eating. And it's really a question of what's the primary thing. Is the primary thing anorexia and they're restricting, and then they binge because they're just so hungry their body's craving food? Or is it recurrent episodes of binging and then exercising to compensate, or vomiting to compensate for binge eating? So it's what's the more prominent symptom there? That leads us to binge eating, which we often characterize as eating addictions. Recurrent episodes of binge eating involve eating in a short period of time an amount of food that is larger than that person would eat in certain circumstances, and lack of control over that. So this is without the purging, essentially. So if there's no purging, it's binge eating disorder. If there is purging, it's bulimia. And it really is like a need to just consume everything because there's so much emptiness inside of you. The binge eating episodes associated with things like eating much more rapidly than normal, eating until feeling uncomfortably full, or even to the point of vomiting. As you'll see in one of the clips provided, the individual, when he finishes binge eating, vomits, but it's not to purge. It's because he's literally so full he can't hold any more food and makes himself vomit because he ate so much. Eating large amounts of food when not physically hungry. And again, this is not the same as like, oh, I'm watching TV and I ate more cookies than I meant to, or I ate more popcorn than I meant to. This is like, I am going to keep eating even though I want to stop. And there's a lot of embarrassment and shame associated with binge eating. So you feel disgusted with yourself and depressed and very guilty afterwards. Obviously, marked distress regarding binge eating is one of the criteria, and this is a pretty distressful life experience. The binge eating occurs at least once a week for 3 months, and not associated with it's not a part of bulimia or anorexia, so there's no purging that goes along with it or restrictive eating that goes along with it. And then you have severity level about how often this happens. And I want you to pay attention to these numbers because we go from once a week to 14 times a week. So imagine going through this experience of binge eating without control twice a day. That's a pretty intense life experience. Now we talk about elimination disorders, and there's 2 that we'll talk about in this area. The first is enuresis. This is urinating in inappropriate places. So avoiding urine into the bed or into your clothes, into corners, on furniture, whether involuntary or intentional. So this is like bedwetting because of nightmares would fall into this category, but also urinating on things as a source of exerting control over the environment would also fall in this category. So it can be involuntary or intentional. Clinically significant by frequency of at least twice a week for 3 months, which is a long time to have a kid urinating on things before you can get a diagnosis. And the presence of clinically significant distress or impairment. They have to be at least 5 in terms of developmental level, right? So this is not like we're potty training and they're having a hard time. This is also not, oh, we have a developmental disability and so they have difficulty controlling their bladder. This is mental. You're always wanting to rule out any kind of physiological reason for anything related to elimination disorders, particularly with kids. So you want to make sure it's not better attributed by some sort of underlying medical issue, a side effect of a medication that they're using. And then we have some specifiers: nocturnal, which means it's only happening at night, diurnal, which means it's only happening in the daytime, or potentially both. And then finally, we have encopresis, which is the same idea, but with feces. So repeatedly passing feces in inappropriate places, meaning the clothing or the floor or the bed or the corner, whether involuntary or intentional. And so same idea as enuresis. So this has to be happening at least once a month for 3 months. So we have a bit of a different criteria when it comes to feces. Chronological or developmental age of at least 4. So again, we're not looking at difficulties with potty training or things better explained by developmental disabilities or underlying medical or physiological issues. This is not the side effect of a substance or a medication, unless it has something to do with constipation. And we do have that option. So it's not just defecating in places that it's not appropriate. It could also be holding in your feces so much so that you become constipated and then you lose control of them, which is another thing we see in children, particularly with substance use, particularly with sexual abuse. So when we see issues of enuresis and encopresis in children, that often is an indicator that there's potential for sexual abuse going on. And it's something you can control. So you can hold it in until you can't anymore because you have nothing else in your life that you can control, or things with your body are not under your control. This behavior, so our specifiers here are with constipation and overflow incontinence. And that's what we're talking about is holding it in so much that you can't hold it anymore, or without that going on.